Hi, welcome to the Currents of Public Health webinar series presented by the School of Public Health at Georgia State University. My name is Brian Greer and I'm the director of the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is Use It or Lose It, the power of utilization-focused evaluation to move data to action. Our guest is Dr. Kimberley Freire, who is a clinical associate professor in the Health Policy and Behavioral Sciences Department within the School of Public Health at Georgia State University. Dr. Freire's research interests include violence prevention, dissemination and implementation science, and evaluation of complex public health strategies. Prior to coming to GSU in 2021, Dr. Freire worked at Centers for Disease Control and Prevention for 14 years, most recently as the evaluation lead in CDC's Program Performance and Evaluation Office. Dr. Freire also worked for 12 years in CDC's National Center for Prevention Research and Control, for Injury Prevention and Control within the Division of Violence Prevention. She has worked in public health within federal, state, and local government, nonprofits, and academic institutions for over 20 years. Her work has focused on applying scientific concepts and data within practice settings and using practice-based evidence to advance violence prevention strategies. Her interests also include working with communities to use data for quality improvement and social change, and organizational learning models to advance public health practice. Before we start, if you have any questions at any point during our conversation, please feel free to type into the Q&A box and we will try our best to answer. So let's begin. Dr. Freire, welcome to the webinar. For our first question, please tell us about your background in public health and what led you to your current role at the School of Public Health.
Hi, Brian. Well, thank you. And I know you shared a little bit about my background, but just to thread through some themes in my career, I've spent a lot of time working in public health agencies, so state and local health departments, public health institutes. So a lot of my experience really is in the applied realm or practice realm. And I've always worked as an evaluator in those different arenas or a researcher in some cases. I've worked for public health, large public health nonprofits and in academia in research roles. So really, I think one of the themes there is I have a real appreciation for what different points of view bring from research and practice, and really do see my role in part as helping to bridge some of that work and thinking about methods that we get from research and in building evidence and bringing those into various practice settings. So that's where some of the focus of my work has been, and certainly appreciate doing that with all kinds of practitioners.
Great. So what is utilization-focused evaluation?
It's a great question. I'm actually here at the American Evaluation Association conference in New Orleans right now. And the person, Michael Quinn Patton, who coined the phrase and really brought this approach. I was at a session where Dr. Quinn Patton was yesterday, so still very much alive in the evaluation world. So just starting with, what is evaluation, which is really like the systematic data collection and analysis as applied to, in our case, public health strategies. So looking at things like the efficiency and the effectiveness of those strategies. And utilization-focused evaluation really brings the lens of thinking about with the end in mind. So if anyone's ever read Stephen Covey's 7 Habits of Highly Effective People, one of them is really starting with the end in mind, which is what it does. So really in defining how are we going to use our evaluation findings, who are the primary users, meaning people who are going to make decisions or do something with it, employ some public health actions. And to really think about that up front before even developing questions. And what this facilitates really is a co-design or co-creation of evaluation with a group of stakeholders, where the evaluator isn't really driving everything in terms of the development of ideas and questions, but really becomes the facilitator for those stakeholders and anchors everything in this idea of the intended uses and users. So in a nutshell, that's a lot of what that particular lens brings to evaluation.
So do you have any examples from your time at the CDC where you use this type of evaluation process?
Sure. I mean, I think of it as part of my socialization. So I really used it, or it was oriented that way in most of the work that I did. But a really recent example right before I transitioned from CDC was work that I did on the COVID-19 response. And so a group of us were brought together to think about how we could develop a process for rapid feedback on what was happening in this case where we started with school mitigation strategies. So this really, we started thinking about, well, the intended use of this was to inform response actions. Our intended users really were the internal leadership of CDC in this case, and we defined that up front as a way to really focus the work that we were doing. And in this case, it was to develop a method and an approach of bringing together both traditional data sources like traditional surveillance data with things that we might call non-traditional. So things like social media, crowdsourced surveys, online focus groups that were implemented in different formats. And to bring that together to be able to answer a specific question, such as how are teachers experiencing school mitigation strategies? What's actually happening in a really near real time way? So that could be fed back into the response itself and other information to inform actions moving forward. So that's just one example of how I've really used it. And just one point about that is, I mentioned rapid feedback evaluation. That's a lot of the way that I've really used utilization-focused evaluation. And again, it's always defining, what is our use or value for these findings before we get started.
So you kind of mentioned this a little bit, but what lessons did you learn from the COVID-19 pandemic concerning evaluation?
Yes, well, I think a big lesson, not necessarily specific to evaluation, but just to data itself that we all experienced and maybe relearned is, where our public health data systems and infrastructure, where the gaps are and where the strengths are too. Although I think the focus, rightly so, has been on where the gaps are. And that's really important to evaluation because, of course, the driver of evaluation is being able to have good data, credible data that's credible to all stakeholders, not just scientists. And so I think one of the big lessons really just was that has been shaping the transformation of public health systems is around data. And the other, from my perspective, is this idea of thinking about evaluation in conjunction with implementation. So a lot of the challenges in COVID-19, of course, there was a challenge in the science itself rapidly emerging and evolving, but they really were implementation challenges of how do we get certain practices in place, vaccine uptake. And so I think what we learned is, thinking more broadly and expansively about different audience segments. And again, having evaluation support more rapid information generation and feeding that back in, I think was a missing piece in some of the COVID response, at least.
So shifting gears a little bit here, do you find that there is a tension between research and program evaluation?
It's a great question. And I will say in my previous position, right before I came to GSU, I was part of an office that was responsible for defining the distinctions between research and program evaluation to put up on the web. And I really struggle with that a little bit because I think there are some false dichotomies that can lead to tensions rather than having an appreciation for each. But in our case, there was a real bureaucratic purpose because if you were defined as research, often there was a different pathway that you had to travel through systems versus program evaluation. But I think there are a couple of high-level things I would say. One is often the focus of research, quantitative research at least, is in this idea of proving a hypothesis or having a study, particularly if it's an experimental study or intervention study, trying to demonstrate the effectiveness of a strategy. Where program evaluation, and some evaluation actually does fall in that category, but would be considered research. When I think of program evaluation, I think of the real emphasis is on improving versus proving. And that's not to say that we don't demonstrate impact, but there's a lot about evaluation that's really focused on thinking about public health strategies that are already in motion or being set up, and the need to have ongoing improvement cycles in order to continue to learn and use that, feed that back in. So that's one distinction I would make. And in a class that I teach on methods and thinking about, one of the things that I offer to students is that, when you think about evaluation, there are maybe three main approaches. And some are used more in research and some evaluation. So you can think about, some people think about the idea of counterfactuals. What would happen if we did not have this intervention or public health strategy in place, and try to approximate that to get an idea of comparison. Some people, another approach is to think about alternative explanations for things that you find in evaluation. And that's one approach. And those first two are commonly used in research, but can be applied in program evaluation. And then the third, which is more common in program evaluation, is to think about making a case, using evidence to build a case. So it's more constructive versus kind of deductive reasoning, but it doesn't mean that we don't think about things such as alternative explanations or apply research methods in order to address things that may be thought of as threats to validity or alternative explanations. So those are a couple ways I think that they have different feels and different emphases. But again, I try not to reinforce positions that, create a divide, because I cultivate an appreciation for what they both bring to public health.
Got it. So do you ever encounter ethical concerns when working with programs to conduct evaluation?
Yes, I think, ethical considerations are things that are always a part of evaluation processes. And something I've been thinking about more since I've been at Georgia State, because I now teach a course in ethical considerations. And so I've learned a lot actually in the past year. But I would say there's two big areas in my own work where there are probably consistently considerations. And one is just working with communities, particularly when, as I have been in a position of working for a funding agency, which creates power dynamics related to organizations that are being funded or working in communities where there is some financial investment in that community. And so I think there are big ethical considerations related to how we work with people in those communities and acknowledging what the dynamics are and trying to be as transparent as possible so that any things that are ethical considerations, for example, people benefiting from the evaluation findings, that we'll eventually have, communities investing their time, resources, and their, literally like their souls in some of this work, but not actually benefiting from it, is a major consideration. How we work with community to construct ideas or interpret findings is another big area. And then the second really is working as an internal evaluator. So working as part of a division, a unit, a program or project. as part of the team, you know, one of the ethical, I think, considerations that comes up again is around interpretation of findings, particularly if there's a perception there are negative findings that could have a consequence. And so I've, you know, over time, you just get better at your craft and practicing things. And so one of the things that I try to do is really from the beginning, it's the framing. And again, it's tying to this idea of uses and users, that an explicit use always is program improvement, which means there's things to improve, which means that we might find things that we have to integrate in our findings, but that becomes hopefully a part of like a learning culture from the beginning versus you know, having fear of retribution or having fear of losing funding or things like that. So I think those are the two big places. And while there have been specific challenges, I think they're pretty predictable and things that should be a part of the evaluation process and thinking through.
So do you currently use evaluation with your work at the School of Public Health?
Yes, well, I do work on some evaluation projects, although I'm relatively new in the school. And so when you're new in your job, you know, I'm just building up the evaluation work that I have in the GSU context. But one of the things that has been really interesting and, shall I say, fun to do is I've been working with Dr. Harry Hyman, the director of the DRPH program. This summer, we actually started to work on a utilization-focused evaluation plan for the DRPH program. So this means we did all of the things that I keep repeating around uses and users. We really started there. And thinking about the priorities for the DRPH program, both in improvement, but also being able to demonstrate the impact of the program and kind of thinking out about what do graduates do when they leave? What are the impacts that they make? And so thinking about what we might be able to collect in the future to be able to build a case for the program itself. So that, you know, before I knew it, I realized, oh, like I said, I'm socialized to do this anyway. So we spent time doing that. And then I was actually able to integrate a rapid feedback evaluation cycle I called data to action. But the idea was that there was one priority, mentorship and networking, that Dr. Hyman had identified from previous information he had collected from different cohorts. And so through our process, that became the priority. We actually just implemented that. There was a survey that went out to students. But before that, students in my methods class helped with defining ideas around mentorship, providing input on the best way to gather information. And I also interviewed some of the DRPH advisors. So now we're in the process of disseminating those findings. And of course, that included first having a meeting with Dr. Hyman and some students in my class to talk about what are some initial actions. And now Dr. Hyman's going to be meeting with the larger group of DRPH students and start to put some of those things in motion. So I would say that's just shows you that it doesn't have to always be about a huge public health strategy. It can be about something within your own organization.
Yeah, interesting. So what is the role of evaluation within health equity? And that's a term, you know, we use health equity all the time in the School of Public Health, but, you know, just what is the role of evaluation in that space?
Yeah, it's pretty big. So I'm just going to touch on a couple of things that I'm excited about and that I've started talking about in the spaces where I work, which is in the classroom largely, and in evaluation consultation work that I do. One, you know, I think more and more what we're hearing about is at a basic level, you know, we need to think more about disaggregating data so we can actually look at differences and where issues are. And I think then pushing beyond that, not just looking at what are the differences, but what may be the underlying condition driving differences. So just at a fundamental data level, I think that's something in evaluation communities that people have pretty much picked up on. But I think the bigger things are, and some of the things that I've found really exciting this past summer is participating in things that are groups that are like the Data Foundation that are really looking at ideas such as validity, which in research and evaluation, we kind of accept as this fixed thing that has certain criteria. And now the idea of equity is bringing in this idea of, a multicultural perspective on validity, how we determine something to be true or valid. And it's very interesting what those perspectives bring in, because I think we're not going to be able to maintain all of the same so-called standards that we have in our methods and approaches without integrating these new ideas. I think equity kind of brings a balance and building out from there. And so those are the two big ones. And I think the other thing that I think I already mentioned related to data systems is really kind of exciting, which is the push in the federal arena to have any kind of research that's been funded with federal dollars, that those data after a certain time have to be made publicly available data sets. So the idea is that taxpayers pay for a lot of the research that happens. And so the public should in turn benefit. And that kind of transparency is another current that I think has the potential to really impact something like equity, because it means that it's not going to be held by just a few people in academic institutions. It's something that will be made to a broader audience.
And that segues well into my next question is how could policymakers use evaluation, and what are some best practices they could possibly incorporate?
Yeah, it's so I will tell you, I'm kind of influenced by the moment I'm in now at this conference, and I just went to something yesterday that made me think about this. So, some of it I might turn it, to answer like how can evaluators help policymakers, but I think one is, policymakers working with evaluators to think about things that are extremely complex. Policymakers are in this arena of like impacting entire systems and really complex systems as well. And so that's a really hard thing to often demonstrate impact. So beyond counting things like number of policies implemented, or some of the indicators that are often used in the policy arena, I think what evaluators can help with is to make connections about how are certain policies truly transformative in a given system. And the session that I went to yesterday was a foundation funder working with their grantees on first really co-developing not just the metrics, but the idea. They use this idea of rubrics of how do we think about success in this arena? What does policy implementation really look like when it's being done well, or even better when it's not being done well? So it's that idea again of like co-creation. But then I think it's getting at kind of the nuance and complexity that is somewhat limited when you're really looking at counts of things. And so what policymakers often are good at is telling the stories of some of the work they do. And I think evaluators can really help with that by really helping to develop these more data-driven pictures of these transformations that can happen when you use these big policy levers to create change.
Gotcha. So this is more of a student focused question, but how could recent graduates of the School of Public Health best use program evaluation as they enter the public health workforce, or students even, as if they're starting to have those conversations on that next level? How could they use the evaluation work?
Sure. Well, first of all, I encourage everyone to get some, if you are at Georgia State, you will have some exposure, of course, to program evaluation through multiple courses, and which I think is exciting and great to have that kind of background. So I think to extend that, what I would say every student leaves with some ability to do things that I think are basic and may not be considered program evaluation, but ICR. One is to ask really good and important questions. So a lot of what evaluators do is help groups shape questions so that what flows from there, really is something that's going to be substantive. So I think that that's a big part of program evaluation that students could bring. Certainly having the ability to look at patterns that are happening, whether it's in the context of delivering public health strategies or in a public health workforce, and to be able to make keen observations about that. All of those things are data. You could think of as data collection, but not everyone identifies as an evaluator, but that's an evaluative thinking kind of idea that they could bring. And then, of course, one of my biggest things, and one of the hardest things I think, which speaks to the title of the talk, is actually using data for public health actions. So I would say that's really where I would love to see students, in their organizations working on that. And, if students are interested in program evaluation, I think there are all kinds of opportunities, not just training, but opportunities to work in units that have a program evaluation function, and to shore up some skills, some methods, and bring that to whether it's strictly evaluation or program development, intervention, implementation. They're all really relevant and kind of a complementary skill set.
Gotcha. Well, we're running short on time. So my final question for you is, where do you see program evaluation in the next 3 to 5 years?
Yeah, I mean, I probably spoke to that in some of the things I mentioned around equity, like really the transformation of data. But I will say one theme that's coming out in the conference is this idea of decolonization. And what does that mean? So again, I've already talked about some of the themes. It's really an idea of having more co-creation of people. The communities that are affected are part of actually developing, managing their own data, making decisions about what's important. And I think you're going to see more around that idea of co-creation. Decolonization is the term, and certainly that's a part of social justice and health equity. And the other thing is really just hopefully an improvement in data systems that we can, so we can be more informed and do better work.
Great. Well, I want to thank you all for attending the Currents of Public Health webinar today. And I want to thank Dr. Freire for participating in this informative conversation. It was really interesting, and to learn more about evaluation that I think a lot of us need to be more aware of. So I really appreciate your time and telling us more about it. In closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master of Public Health degree in 6 concentrations, a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health. The faculty and students conduct research on the complex public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, their residents, and community-based organizations committed to health equity. If you would like more information about our programs or how to support the school, our students, and our work, please visit publichealth.gsu.edu. Also, thank you again to Dr. Freire, and thank you all for attending. I would like to ask you all to please join us for the Kruder-Katz lecture on health equity. It's next Tuesday, November 15th at 2 p.m. The lecture can be in person or online, and you can find out more information about it by visiting publichealth.gsu.edu and scrolling down to the public health news section. The lecture is going to feature award-winning journalist, author, editor, novelist, and educator Linda Villarosa. So we're really looking forward to that, and we hope to see you all there. Thank you all again for attending, and be well.